Hello and welcome to Minutes with the Coach Success in Dentistry mini-series episode 5. In our last episode, we decided that if there's a certain very productive type of dentistry that you really enjoy and that you want to do more of, if you want to become more clinically proficient at this type of dentistry, if you want to become better at inspiring your patients to desire this type of dentistry, then your opportunity is to turn your schedule almost into a receptacle for capturing more of what it is that you love doing. So we do this by blocking out a full day each month for doing that specifically which we love. And you, in a sense, are paving the road ahead such that it will support or capture the type of driving that you want to do on it. So by blocking out your schedule, you are also preventing the regular general practice day-to-day clinical demands from encroaching on that day because you have essentially taken that day out of your general practice radar screen and you call that day your level 2 day. So today we will look at a similar strategy, which is pre-blocking our schedule. Only in this case, we will not be pre-blocking our schedule for level 2 dentistry or advanced dentistry. We will be pre-blocking our schedule to give us the time and flexibility to comprehensively serve and complete diagnosed care. In other words, patients that are seen today must be able to receive their treatment plans or their treatment within a reasonable and short period of time from the time of diagnosis. And we will do this by pre-blocking. So allow me to explain. So as we said the last time, busyness is the enemy of profit. And one of the biggest misconceptions in dentistry is that busyness is actually good. You see, having lots of patients that need or desire your treatment or your care is good. But a tightly filled schedule that has no flexibility or openings in it is not a good thing. No schedule should be booked in your office, in a dental practice, solidly more than 1 week out. And let's explore the reason why. An average dentist might see 8 patients per day. They might see 6 hygiene exams in the dental hygienist treatment room, and they might see 1 or 2 emergency patients. That's a total of 16 patients. If you look at those 16 patients, of those 16, there's a number of treatment hours of productivity that are going to be diagnosed by that dentist when the patients walk up to the front desk. I have found statistically from measuring this that on an average day, somewhere around 7 to 9 hours of diagnosed treatment hours actually comes out of the back from the doctor, whether it's from emerges, from the hygiene exams, or from treatment that's diagnosed in their treatment room from patients they're seeing that day. And the key here, the ticket is that if the dentist is diagnosing that many hours of treatment on an average day, some of that treatment we have to assume is going to be urgent or will need to be done right away or won't be able to wait. So if we look at our schedule and our schedule is booked solidly more than 1 week out, where are we going to put these people? If someone needs to come back right away for pain or a root canal completion or anything of that sort, where are we going to put those people if the schedule is packed solidly the following week? Well, what I find is we end up squeezing those patients in. We end up squeezing them into the beginning of our day, the end of our day, into our lunch hour, and sometimes we end up just squeezing them in on a third room in between patients. And I don't think this is a very productive or prudent way to kind of practice or do our dentistry. So the solution to this is that we organize or structure our schedule so that we have blocks put into our schedule that will allow us room to capture treatment that's been diagnosed today. So here's how this strategy works. Step 1. On Monday when you arrive to work, the following Monday should contain 2 pre-blocks, maybe an hour in the morning and maybe an hour and a half in the afternoon. This time will be specifically reserved for the clinician, the dentist, to use on that day. It is not to be used by the front desk. So on Monday when you come into work, the following Monday has an hour opening in the morning and an hour and a half opening in the afternoon. On Tuesday, when you come into work, the following Tuesday has an hour pre-block in the morning and an hour and a half in the afternoon. So on for the rest of your week. This time is used specifically by the clinician. So when the clinician is conducting their hygiene exams, or when the clinician is seeing their patients in the doctor's treatment room, any treatment that comes up that they find needs to be done right away, at the clinician's discretion, they can offer next week's pre-block to that patient. And the way to do this strategically is don't offer the pre-block first. As a clinician, if I'm looking at my patient today and there's something that I've diagnosed that I know needs to be done right away, step one is to offer the patient the first available opening, which is at the end of your schedule. So John, great, here's what we see in your mouth. Our first available opening is 4 weeks from today or 3 weeks from today. But this concerns me because I think that this should be taken care of a little sooner for you. So I have reserved special time in my schedule next week to complete care that has been diagnosed on our patients this week that's urgent. That time is next Monday at 10 o'clock or Monday at 1:30, which will be best for you. So you offer them the end of the schedule, which is obviously too long a wait for their treatment need. And then you offer them a solution to not waiting as long, that you offer them next week's opening. Now remember, pre-blocks are not considered openings. In other words, they should not be used prematurely. We don't use a pre-block 3 weeks from today for treatment that's being diagnosed today. Next Monday's pre-block is used this Monday. Next Tuesday's pre-block is used this Tuesday, and so on. And so you kind of keep it structured that way. And at the end of your day, if you have found that you have not used your block time, then it becomes open for the front desk to fill the next day. But you'll find that this never happens or rarely happens because there's always going to be treatment that's diagnosed on that day, because as we said, the average is about 7 to 9 hours of diagnosed treatment. Some of it will be urgent on an average workday, so we put it into our pre-block time, and I'm certain that you won't find any pre-blocks available at the end of any day. So how do we make this work in our practice? Well, simply we take the computer, we put into the computer a fictitious patient name, we call that patient pre-block, and then put pre-block into each day at the specific length of time that you want to have them. And generally, most people I find choose an hour in the morning and an hour and a half in the afternoon. But that can vary based on your office and the demands within your practice. So there we have it. We must never saturate our schedule to a point where there's no flexibility in it the following week. Prepare in advance in your office for schedule saturation. The priority in your office should always be to patients that are seated in your chair today. In other words, there's no rationale for simply answering the phones and filling your schedule, without preserving into your schedule room to actually serve those people that have been placed in it. Whomever is seated in your chair today is entitled to know that you have room in your practice or in your schedule to deliver their dental health needs within a reasonable and short period of time from the time of diagnosis. So the other thing I want to add here is that from a business perspective, as soon as you begin blocking out your schedule, you will find that your entire schedule expands by about 20%, which means you will actually experience immediately 20% of growth within your practice in profits and growth in productivity, merely as a result of blocking out your schedule, which immediately expands it. This always happens when this system is implemented properly. In every office that I've worked in up to this date, any time that they've put pre-block time into their schedule, they've immediately experienced an expansion in the demand for treatment hours and clinician hours, which immediately is reflected in the form of growth within your practice. So to learn more about this, please feel free to email or call me at the number listed below. And on behalf of myself, Peter Barry, and the Halton Peel Dental Association, we look forward to seeing you next month. In our next episode, episode 6, we will explore the important concept and strategies behind conducting powerful and results-producing new patient exam experiences. We want to deliver a new patient exam experience that helps our patients to feel confidence in us, that helps them to feel that they found their dental home, and that helps them to, or that inspires them to take action and act on things that are in their best interest. We'll see you next time.